Okay, I'm going to go ahead and discuss a couple factors that interfere with my ability to listen effectively to patients, or maybe if there are some type of communication barriers that we have from clinician to the versus the patient. There's two topics here in the textbook after reading the chapter that I thought were very relatable to me and what I go through in the clinic as a technician. One of them is actually role uncertainty. I think that's a very big barrier in effective communication within the clinic, especially with the middle-aged to older population that we get of patients in the clinic. Once their primary therapist has finished their manual therapies with the patient and they're busy because they have other patients that need manual therapy as well, or any other type of hands-on uh, therapy that I can't do because I don't know. They pass them down, they hand them off to us so that we can finish off their exercises, and then any type of modality if they end up finishing with the ice or anything like that. That handing down, they see them, some of those patients see them as like throwing them away to us, or like handing them down to us, and not, they kind of don't see us as being equal to the therapist, and they don't really trust us in a way. So the therapist has to really have a type of communication to that patient saying, you're in great hands with Tatiana or whoever other tech I'm working with that day. You're in good hands. They're going to take very good care of you. They know exactly what you're going to be doing. And so it's always that reassuring to the patient why our role as a tech, and that we are there to, finish their treatment, and we're just kind of extension of hands to their primary therapist. And without that effective communication from the therapist to the patient, I always like to make sure that I say it as well, or if I don't hear the therapist say that as they're handing them to us, I make sure that I have that communication with them, so not so that they don't look at me or they don't look down at me, or they're, why are you working with me? How come I'm not working with my therapist anymore? And, well, what is this going to be doing? Why is this helping me? And they start asking a lot of questions to kind of test you to see if you know what you're doing. So I think effective communication in that sense of handing from therapist to tech is very, very, very important. And we also make sure in our clinic that we have that communication as well, so that the patient feels confident and comfortable, and feels like they can trust us throughout their whole entire treatment when they are there. Another topic in reading the chapter that I thought was very relatable as well was gender differences. I work with two other techs who are males, so I'm the only female tech, and I have noticed that certain male patients like to work with the male techs because they can relate to them more. They can talk more to them about sports, business, politics. If that ever comes up, we try to kind of stay away from the political talk, but it happens. And but yeah, they feel like they can relate to them more than with me. They feel like even if they talk to me about sports, I can talk to them about basketball. I like watching basketball and some kinds of football. But I feel like I don't get that kind of interaction with them. And so they actually request to work with the guys instead of me sometimes. And, I kind of have to take that with a grain of salt. They feel more comfortable with the males because, they have more in common with them. So, I mean, that's something that I encounter with as well. And so, I think that kind of interferes with treatment a little bit. But, I've learned throughout my 3 years of being a tech that, it's all about knowing your audience and how to just, that your job is to, make that patient feel as comfortable as possible, and kind of just working through those barriers and trying not to let those barriers become an issue in treatment. So those are the factors that I think that interfere, and that's it. Thank you.